Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Ovarian cause. WHO classification. Class 1. Hypothalamo-pituitary ovarian axis failure is seen in 10%. Example, Kallmann syndrome. In Kallmann syndrome, there is hypothalamic failure with anosmia and there is decreased gonadotropin releasing hormone. Thus, there is decreased luteinizing hormone and decreased follicle stimulating hormone. Treatment of Kallmann syndrome is gonadotropin releasing hormone is given in a pulsatile manner. Class 2. Class 2 is hypothalamo-pituitary ovarian axis dysfunction. Hypothalamo-pituitary ovarian axis dysfunction is seen in 85% of cases. The causes of class 2 or hypothalamo-pituitary ovarian axis dysfunction is polycystic ovarian disease and ovulation, increased prolactin. This hypothalamo-pituitary ovarian axis is most easily treatable form of infertility. Class 3. Class 3 is premature ovarian failure or premature menopause, which is seen in 5% of patients.
thank you and thank you for watching.